All right, good afternoon. I trust you are all doing well. Um, and you had a good week. I was hoping we'll get quite a number of you joining, because when we start and people join in the middle like that, they don't get to know what we are discussing, but we can't wait for them forever. So we are going to start today's meeting and continue with what we were discussing last week. So, before we go ahead and look at our discussions, um, based on what you've learned so far in pharmacology, is there something that has happened on your ward, in your practice, that um, one maybe you thought with your knowledge you could have handled it better, or something that has improved since you started learning pharmacology? And someone, just one or two people, if it is possible, share with us any experience at all in the past week that at least we can all learn something from. So if you have such an experience to share, just raise your hand and I'll ask you to unmute. Nobody wants to share anything, or what you are learning, we are not putting it into practice, or we are not learning anything at all. Hello? This is supposed to be a okay. Williams, please, you can unmute.
Okay. Please, Doc, with regards to the drug-drug interaction and the drug-diet interaction, being able to improve my knowledge on it, and it has helped me to actually acknowledge the fact that we are not supposed to serve certain medication with certain foods. For example, taking in Cipro with milk would affect the efficiency of the drug, and also certain drugs also affect the potency of the other. So we are supposed to take the drugs at different intervals. So it has helped me improve my knowledge at that aspect, and that is what I have picked from the pharmacology we have done so far.
Okay. Thank you very much, Mr. Williams. That's very important because, well, if you learn and you don't pick something to use for us as nurses to help in our practice to improve our patients' outcomes, I don't think the learning is taking place. So I encourage all of us, try as much as possible, whichever course that you are learning this semester and subsequently till you finish, try and get something from it, not just for writing exams, but to be able to um, put it into practice so that it would affect your patient's outcomes. All right. So this afternoon, I want us to take a look at another pharmacokinetic parameter, that is the drug's half-life. Drug's half-life. Okay. Whilst I'm sharing my slide, which you have already, you find it in the lecture 5 on drug excretion. Whilst I share that, Hager has put something there that she used to crush some uncrashable drugs, which now she has to check before serving it through the NG tube. Very good. It's also a very important aspect of our practice that we have to check. Otherwise, our patients will not get the best out of the medications they are on. Okay, so let's quickly look at elimination half-life. A lot of us, when we talk about the half-life, they are thinking of something, some huge numbers, the quantity of the drug and those things. But when we say the drug's half-life, we are talking about time, the time that it takes for uh, for for a drug to be the concentration of the drug to be halved, okay, or to be reduced by 50%, or the time it takes for the body to eliminate half of the amount. All right. Half of the amount. So if you give a patient, let's say 50 milligram of a drug, how long it takes to for the body to reduce the plasma concentration by 50%, meaning that the body would eliminate 25 milligram of that drug. That is the half-life. The time. So if it takes 4 hours, we say that for this particular drug, the half-life is 4 hours. If it takes 10 hours, if it takes a day, if it takes 30 minutes, we say that for this drug, the half-life is that particular time. Now, you can actually calculate this from the plasma concentration curve. You can also use a formula to calculate it. And let me share that formula with you, though this is not really, the formula is not really part of what we are supposed to know, all right, but it's important that we understand some of these things and see that will also help us to, where's my whiteboard? That will help us to even determine how often we should give a drug, and then also how um uh, how much of the drug is being given, what other effects does it have. Okay, so the half-life, it is denoted as T half, all right, and the formula is 0.693. In some books, they would convert this to, I'm trying to look for, forgive me, I'm trying to look for my whiteboard, and I can't find the whiteboard. So the writing, let me just give you the formula. The writing is challenging for me. So let me quickly give you the formula. You can write it down. Okay, you can write it down. So the formula is 0.693, all right, or 0.7 if you run it off, times the volume of distribution divided by the clearance of the drug. I think last week we talked about the volume of distribution, all right? The clearance is the rate of elimination of the drug, and it is given in liters per hour. So for a particular drug, you can have the clearance to be 4 liters per hour. Okay. All right. So when you have these formulas, you can easily calculate the half-life of a drug. But you can also get this information amongst the other pharmacokinetic properties that we talked about, bioavailability, volume of distribution. You can get all of that when you read about the drug. So when they are determining the the pharmacokinetic properties of a drug, or during the drug development process, they determine all of these things. So when you read anything, if you want to read about a particular drug, whether you are using the BNF, whether you are using the Medscape app, whether you are using the information leaflets in the drug, it will tell you what's under the pharmacokinetic property of that drug, or the pharmacology of that drug. It will tell you the bioavailability, it will tell you the volume of distribution of the drug, it will tell you the half-life, the clearance, and all that. All those parameters you can find under the volume, the pharmacokinetic. Okay, please let me just type it out and put it there. It is 0.693 times. So I'm putting it there. I hope it comes. Okay. Volume of distribution. If you remember, volume of distribution is the apparent volume into which drugs appear to be distributed throughout the body. Then the clearance, like I explained. So if you know the volume of distribution of the drug and you know the clearance, you can determine the half-life of the drug. Okay, I have just posted the formula there for those of you who were asking. All right, but I'm also saying that for the drug half-life, okay, for the drug half-life, you can determine it by, you can get that information from the drug information leaflet. You can get it from BNF, any drug reference material, you can get it from it. Okay, so anytime you want to know the half-life of a drug, this is where either you calculate it to know, or you read the you read from the pharmacokinetic profile of the drug and you get the half-life. Okay. Now, the half-life helps us to determine how frequently you give a drug. Okay. I would use paracetamol as an example because everybody is very familiar with paracetamol. So with paracetamol, the half-life is between 2 to 3 hours, meaning that if I take paracetamol by 2 to 3 hours, I would have eliminated half of the amount, the concentration of it, or the amount that was introduced into the body, all things being equal. Okay. So if I have 1 gram of paracetamol and I take it at 6 a.m., by the first half-life, let's take the highest range, which is 3 hours. By the end of the first 3 hours, so around 9 a.m., okay, I would have eliminated 500 milligrams. So the first half-life will happen after 3 hours. Then after another 3 hours, I am going to eliminate another half of whatever is left. Now, drug response is related to the amount of, or the concentration of the drug. If you have enough drug molecules to produce the therapeutic effect, yes, you see the therapeutic effect. But if the concentration starts to drop, you would also start to see that the therapeutic effects of the drug that you were expecting starts also to come down. So let's assume that you have a headache, a very bad headache, and you took 1 gram of paracetamol to help relieve your headache. After about an hour, you start seeing the effects of the paracetamol you took. So probably your headache, you start feeling that the pain starts coming down. Okay. By the end of the 3 hours, you realize if you don't take another dose between the time you are asked to take another dose, you realize that the pain starts coming. So after about 6 hours, you realize that the pain starts coming back. After about 8 hours, yes, the pain will start coming back. And so if you don't repeat the dose, you are likely to get the pain back again. And that's how come for majority of the drugs that we use, you need to repeat the doses. Okay, you need to repeat the doses so that the therapeutic effects of the drug, you will continue to see it. All right. So knowing that paracetamol, the half-life is about 2 to 3 hours. If you don't repeat the dose, by the time you get to the 4th half-life, you are likely to have eliminated almost all the drug. Let's quickly do some small calculation. If I have If I have 100, let me, I'm trying to get my whiteboard. One is a bit transformed. Let me just insert a slide here and type. So if I know that, please follow what I am typing, okay? If I take at 6 a.m., I take 1 gram of paracetamol. Which is the 1 gram is the same as 1,000 milligrams. I hope you know that. I take this at 6 a.m. I know that the half-life of paracetamol, so let me come up here. The T half of paracetamol is 3 hours. Okay. And I take this as 6 a.m. What this means is that after 3 hours, which is 9 a.m., I am going to have the concentration of paracetamol reduced by half. I'll eliminate 500 milligram, okay, meaning that I have 500 milligram remaining. Please, I hope you are following. And this is the first half-life, okay? This will be the first half-life. So now you have eliminated 50%. All right, so you've eliminated 50%. If you don't take another dose, what will happen is that by 12 noon, of the 500 that is left, you are going to eliminate 250 milligram. So that is the second half-life. Okay, I hope you are following. So by now, what percentage would I have eliminated? Please, what percentage would I have eliminated after the second half-life? Yes, Solomon. Please, you can unmute.
Around 25%.
I would have eliminated 25% of 25% of what? Because I
50
told
milligram
you
of PMO.
25% of the 250 or
Yes,
25% of the 250 is what I'm going to eliminate. Is that what you are saying? Okay. So by the end of the second half-life, I wouldn't have eliminated 25. Please, I hope you are following. Now, I've already eliminated 50 milligram. And the half-life is the time it takes for us to reduce the concentration by half. So at this point, I have eliminated 50% already. So 50% of the drug is gone. At the end of this half-life, where I've eliminated another half of what was left, I have eliminated 75% of the drug. Please, I hope you are following. So at this point, I've eliminated half of the 500 plus the 50%, the 500 milligram that I eliminated. So I've eliminated 75. Now, by this time, I would have only half of 250 milligram of the drug left. Ibrahim, you can unmute. Okay, Ibrahim. Okay, Rose, I don't know if you have questions or you want to contribute to it.
Madam, please, I have a question.
Please go ahead.
Okay. So, Madam, with the first half-life, that is from the 6 a.m. to 9 a.m., we were able to eliminate 50%, that is half of the PMO that the patient took. And then at the second half-life, that is another 3 hours period from 9 to 12, the patient eliminated only 250 milligram. And it's like, I am expecting that by the 12 noon, maybe the patient should eliminate another 500 because it's another 3 hours difference.
Okay. So I get you.
Okay.
Have you ended your question?
Yeah, so I want to know whether there is a reason for that, or maybe you are just setting an example and that's why you did it like that.
Okay. So yes, I'm using paracetamol as an example, but it is what is left in the body that the body will reduce by half at every point. Note that for drug elimination, it is an irreversible process. Once you eliminate the drug, you excrete the drug is not coming back inside you. So let's say you've urinated and part of the drug came out with the urine. It is not coming back. Okay, I want us to get that. Now, the first one, let me make it 1,000 so that at least everybody will know where we are. The 1 gram may confuse some of you. So you gave the patient 100 milligram of the paracetamol. Now we are saying that the half-life is the time it takes for the body to reduce the concentration or the amount of the drug by half. Please, let's get that. So whatever concentration at the end of the half-life, the body is going to eliminate half of whatever is there. So we gave the patient 1 gram, which is 1,000 milligrams. And the half-life, as we've already gotten to know, is 3 hours. So if it is 3 hours, it means that by 9 a.m., the patient would have eliminated half of what you gave to the patient. Please, I hope you are following. Now, if you give the patient eliminates half of what you gave, it means that half is remaining. So the patient eliminates half of this. Half of 1,000 is 500 milligram. So 500 milligram has left the body, remaining 500 milligram. So at the second half-life, the body is also going to eliminate half of whatever is there. So it's 500 milligram that was left. You didn't add on. We've not gotten to that point yet. It's just that single dose that you took, which you have eliminated 500 milligram. So what is left in the body is what is going to be, half of it is going to be eliminated out. Let me give you a simple example. So I go to the market. I go to the market. I buy 10 fingers of plantain. 10 fingers of plantain. Now I decide that I am going to use 5 of them this evening. So I prepare the 5 of them. I eat them. Once I've eaten it, I am not getting my plantain back. Now, if somebody comes to visit me and I need to cook some for the person, I decide, okay, let me use half of whatever is left. I don't think you will consider the first half that you ate. You are going to use whatever is left. So when you use 5 of your plantain, you still had 5. So now if someone has come to you and you are using half of what is left, it means that you are going to use 2.5 fingers of plantain and prepare it for the person who has visited you. If another person comes and you decide that you are going to use half of what is left, is the half of the 2.5 fingers that you are going to use. Please, I hope you are getting me. Okay. So now at the end of the first half-life, already we have eliminated 750 milligram of this drug. That's about 75% of it. So at the end of the third half-life, all right, which would be 3 p.m., okay, we are going to eliminate half of this again. That would be, I think, 125 milligram. Okay, this will be at the third half-life. And by this time, how much would be, what percentage of the drug would be eliminated? I hope you are following. If you're able to give me the percentage that will be eliminated, then I know that you are really following. Okay, the comments have started coming. Percentage. Whilst you are typing in your numbers, let me say something about numbers and units. Okay, numbers and units. If you write a number without a unit, it is just a number. It doesn't mean anything. And especially in our practice, if you just write, so let me just say, I've written 3, the number 3 here. It doesn't mean anything. If I add age, it's 3 hours. If I add this kilograms, 3 kilograms, is not the same as 3 liters. Neither is it the same as 3%. Please, I hope you are following what I'm saying. So never write a number and leave it just like that. Once at it and you are still looking at the percentage, let me tell you a story that really happened in a hospital. So the nurse, a mother came to a nurse and said, my daughter's temperature is really high. Instead of the nurse getting up in the first place to go and check the temperature, the person didn't get up, but just said, oh, so she's hot. Okay, do you have para? Okay, give her 10. She didn't say 10 mils, 10 milligrams, 10 liters, 10 whatever. She just said 10. Now, do you know what this woman did? She also went to her child, knowing very well how high the child's temperature was to when she touched her. The mother went and poured 10 cups, so the medicine cups, 10 of them for the child. This was someone the mother had not has not had any formal education, okay, and the nurses had not also educated the mother on the quantities of medications. So the woman just said, the nurse just said, oh, in our local dialect, oh, she 10 man. And they don't even go and check on the child. So she 10 man on or pour 10 for the child. The woman went, picked the medicine cup that comes with the paracetamol and poured 10 of them. By the time she was through, the whole bottle was gone. And a couple of hours later, the child started being lethargic, vomiting and all that. So please, this is something that really happened, almost caused the nurse to lose her job. Okay, almost caused the nurse to lose her job. So please, never write a number without putting the necessary units there. All right, so we are moving forward and I have seen your answers. So the answer is actually 87.5%. And this is how we got the 87.5%. Okay. By this time, what is left in the patient's system is 125 milligrams. So there are several ways you can look at this. You can get the percentage from, at this point, you have 25 milligram and 25% of the drug left. So if you've halved it, it means that you have 12.5. You can add that to the 75 that you had here. Okay, let me annotate the 75 that you had here. So plus the 12.5, which is from the 25. If you have eliminated 75% of the drug, it means that you have 25% of the drug left. So if you eliminate half again, you add the percentage to it. So the 12. So plus the 12.5%, and that will give you the 87.5. Another way you can look at it, all right, is that you find the quantity that is left, the 125 milligram that is left, its percentage by dividing 125 by what do you call it? The 1,000 multiplying by 100%, you get your 12.5, and then you add it to the 75%. Then you can also subtract the 125 from the 1,000. Whatever you get, you find its percentage, and that will give you the 87.5. Okay. Now let's look at the the fourth half-life. That will be at 6 p.m. How much of the drug would we eliminate, please? By the fourth half-life, okay. Okua, Patricia, you can unmute.
62.5 kilogram.
Yes, 62. So half of the 125 there. So 52.5 will be eliminated, meaning that you have 62.5 left. And what is the percentage, please? Percentage that would have been eliminated, and what would be left? Belinda, you can unmute.
Please, it will be 93.75.
Very good. Please, I hope we are all following you. So 93. So what I want to draw our attention to is the fact that if we give a medication, okay, if you give a medication and you are supposed to repeat that medication at a point and we don't, the concentration of the drug, by the time you get to between the fourth and fifth half-life, almost all the drug would have been lost. And you would have to start all over again if you want to reach the therapeutic concentration. And that is how come it says very, very important as nurses, when we are administering drugs to our patients, we need to follow the time. Okay, so if the patient is supposed to take the medicine every 8 hours, we must make sure that the patient gets the medicine every 8 hours. Yes, the workload is there. Sometimes you may have to start early, but it is allowable to give the drug either an hour before or an hour after, within the time. So the drug is supposed to be given at 2 p.m. But when you look at the number of patients that you have, if you start your drug administration, say at 2 p.m., you are going to take much, much longer. And that will result in some of the patients not even receiving their drugs at the right time. Okay, so what you can do is that you can start like some 30, 40 minutes earlier than the 2 p.m. and that is allowed. Okay, but if you wait and wait, or what some of us and some of our patients, what they do, they are supposed to be taking the medication over a period. They take the medicine after 2-3 days, they feel okay, they stop taking the medicine. And you realize that when the whatever disease it is, it comes back, or they even want to continue their medication, they would have to start all over again. Because by the time the drug has reached its fourth to fifth half-life, you would have eliminated over 90% of the drug, which is not enough to cause the therapeutic effect. Please, I hope you are following. Good. Now I want us to look at another thing. So how do we ensure that we continuously see the therapeutic effect we are looking for? So you had the headache, you took just one dose of the paracetamol, and the headache, after some time, you had some relief. But because you were not taking you did not repeat the dose, there are some headaches that just 2 tablets will do the trick. There are some headaches that you need to take more than the 2 tablets. Okay, so if the patient you don't repeat the dose, okay, if you don't repeat the dose, you are going to eliminate the rest of the drug. by the fourth half-life. And that means that the effects that you are going to, you expect to see, you would not see. So this paracetamol, we say that you can take paracetamol every 8 hours, depending on even the pain and the kind of fever. You can even do every 4 hours, but because by the half-life that we know, which is 3 hours, means that whatever dose that you used, by the 3 hours, the concentration would have reduced by half. Okay, so anywhere between 4 to 6 hours, you can take your paracetamol. Normally, for most of our patients, we do the 8 hours, which is okay. Okay, which is okay, especially if you are taking it over a period. But if it is for just some quick pain, let's say some bad headache or some menstrual pain, or for a child with a fever that does not seem to come down, okay, you give the paracetamol between 4 to 6 hours, and it is okay because of the rate at which it is because of the half-life, all right, and the rate at which it is eliminated. Good. But let's assume that we are giving the drug, okay, and we are repeating the doses. All right. I want us to look at how we arrive at what we call the steady state concentration. The steady state concentration. We those who want me to go over the calculation, we are going to go over it again. Okay, we are going to go over it. But there's an example, all right, that here I'm using only 50 milligrams of the drug. Okay, so when we talk about the steady state concentration, we are looking at the concentration at which the rate of administration of the drug equals the rate of administration of the drug. At this point, the number of the amount that you are adding, okay, the amount of the drug you are adding equals the amount of drug that is being eliminated out of the body. That is what we mean by the steady state concentration. Okay, so with this example that we have here, we are saying that we have 100 milligrams of a drug, okay, and the drug's half-life is 4 hours. So at the end of the first 4 hours, let's say we give the drug at 6 a.m. By 10 a.m., which is 4 hours after the 6 a.m., we would have eliminated the 50% of the 100 that we put in. So it means that we will have 50% left, which is the 50 milligram. If at this point I add a second dose of the drug, so at this point I'm adding 100 milligram of the drug, please, how much of the drug would be in the patient's system now? Let me change the color here. Is how much of the drug would be in the patient's system now? Okay, let me look at the hands. Irene, please unmute. Okay, please, numbers and units are not written together. Okay, my dear, as you can see from my writing, the number, space, and then the unit. Let's take note of that. When you write the number and the units together, it means that the number is being multiplied by the unit, which is not so. Okay, okay. So it will be 150 milligrams. That would be in the patient's system now. Okay. What would be the concentration for the second half-life? How much of the drug would be eliminated now? Okay, Mumin, you can unmute. At the second half-life, please ignore the other numbers. Mumin, please go ahead.
Okay.
I'll type it in red.
I didn't get the
How
answer,
much would
the question well, sister.
Oh, then why is your hand up?
No, it was the first question when you said how much
Okay.
after adding the.
Okay. So now we
So the
have
question
150.
again, so that
We have 150.
okay.
The second half-life, which is 4 hours after 10 a.m. How much are we going to eliminate?
So means we'll eliminate another 50, leaving 100 milligrams.
We are eliminating half of the amount of drug. Half-life.
Then that would have been 75 milligrams.
Very good. Thank you very much. 75. I'm using the red to differentiate the numbers. Okay. So the 50-25, let me say this before somebody thinks that. So the 50-25, 12.5 is from a single dose. Okay, it's from a single dose. So now we have eliminated 75. The reason why we have eliminated 75 is that we added a second dose of the drug, and the amount increased to 150 milligrams. Okay. All right. Now we are going to add a third dose of the drug. A third dose of the drug. How much would be in concentration now? How much of the drug would be in concentration now? We have added the third dose of 100 milligrams. Good. 175 milligrams. 175 milligrams is what is there. Now, how much are we going to eliminate? All right. Zidefo, I hope I got your name right. How much are we going to eliminate by the third half-life?
Hello, sister.
Yes.
Yeah, the name is Jidefu, but you've tried.
Please, can you say it again?
It's Jidefu.
Jidefu. All right. Please, what does it mean?
It's courage.
Courage. All right.
Yes.
Okay. So if I want to say have courage, how would I say it?
Legidefu.
Again?
Legidefu.
Legidefu. All right. Thank you very much. See, I've learned something today. Okay. Yes. So go ahead.
So for the 175, we'll be eliminating 87.5 milligram.
87.5 milligram is what we are going to eliminate. Thank you very much. Therefore, we will go on. All right. So at this point, you see that we started giving the patient what? 100 milligrams. I hope you remember the original amount that we gave to the patient. This is the original amount of the drug that we gave to our patient, right? 100 milligrams. By the end of the second half-life, we are at a concentration of 87.5, which is nearing the 100 milligrams. So if I add another 100 milligrams here, how much would I have? I've added another 100 milligrams at this point. 187.5. Yes, very good. You are following. Okay. Now, how much am I going to eliminate? How much am I going to eliminate from after the at the fourth half-life? Please, let's learn numbers and units. Numbers should not be written alone. All right. A number should always be followed by a unit, and the units should be separated. There should be a space between the number and the unit. Okay. So as you can see, we are nearing, okay, we are nearing the 100 milligrams that we introduced. Let's look at the fifth half-life. So at the end of the fifth, after the fourth half-life, we have 93. How much would I have left? I've added a fourth dose of 100 milligrams. Yes, 193.75 milligrams. That is what I will have. Okay, that is what I am going to have. So if I have 193.5, how much would I be eliminating? Yes, 96.875 milligrams. Okay, that is how much I'm going to eliminate. Now, as you can clearly see, it is almost getting to 100 milligrams. Okay, so at this point, usually we say that by the fourth and fifth half-life, the steady state concentration is reached. I am going to explain it again. Okay. So you have a drug. I want to use something that we can easily relate to. Okay. So in your home, you decide to buy a pack of toffees. Okay. A pack of toffees. And you give out some of your toffees to the children in your compound, something like that. So you decided that the toffees were 50 in number. So 50 toffees. And you had some children in your compound. You decided that you give them 25 toffees every day for the next couple of days. But you bought only 50 toffees. How do you ensure that after taking out some of the toffees for your for the children, okay, you would have a steady amount that you will not run out? If you continue to top up your toffee, okay, if you continue to top up the quantities of your toffees, you are not going to, yes, by adding more. If you top up, you are not going to run out of the toffees. But if you don't top up and you bought only 50, so day one, you gave the children 25. Day two, they came back for more. You gave them 25. Now you are at 0. The children, maybe they like you because you give them the toffee. But once you don't have the toffee, okay, once you don't have the toffee, they don't want to come near you. But if every day, for the next couple of days, you continue to top up your toffees, so you gave out 25, you had 25 left, and you went out again, you bought another pack, you came to add 75, 50 more. So plus the 25 that you had left. Okay, you now have 75 toffees. If you give them 25, you still have if you give them half of that, half of the 75, you have decided that you are going to give, every time you are going to give them half of your toffees. So the first one you had 50, you gave them what? 25. But you don't want to run out completely. So what do? You bought another pack of 50, you came to add, you got the you got 75. You decided that you are going to give them half toffees half of your pack every time. But if you don't monitor, or if you don't keep on adding, okay, you are going to run out of the toffees in just a few days. And that is what we are saying. For our patients, when they are on the ward, or we ourselves, when we have to take any medicines, and we don't continue the regimen that we are supposed to be taking, you are supposed to take the medicine for, say, 5 days, every 8 hours for 5 days. The implication is that if you don't take it every 8 hours for 5 days, the concentration of the drug would start reducing. So the first day you took your first dose, okay, yes, you started feeling better. So you decided, oh, now this medicine is very good. Just one dose, I'm feeling better. I will not finish my medication. What will happen? After the first half-life of the drug, the concentration will drop by half. The second half-life will cause the concentration to drop further by half. It will continue like that up to a point where you are going to have almost no drug in your system. And you start having the signs and symptoms that you had before starting to take your medicine. So what do if you want to continuously see that effect? You need to have the concentration of the drug in a steady state. Okay. Steady meaning that in a almost constantly equal levels at all the time. As you are eliminating, what you are eliminating and what you are putting in should almost be the same, so that there is no significant difference in the concentration of the drug or the amount of the drug. So if I took 100, all right, in the morning, and I add and I eliminate 50 of it, and I add 100 again, I've eliminated 50. That one is gone. It's the 50 that is left. So I add another 100, I have 150. So just like the toffee, I go and buy 50 more, plus my 25, I have 75. I would eliminate, or in case of the toffee, I give out half of it, which is the 37.5. If I don't come and add more of the toffees, the next time I won't have more to give. I'm going to run out of the toffees very soon. So that is why I'm saying that it is important that as nurses, as individuals, when we are taking our medications, if we are asked to take it every 8 hours, we have to stick to the every 8 hours until the medication is done. Okay? Please, I hope it is better now. That's the clinical implication of the half-life. You need to take the drug so that the effects of the drug, you are going to see it. So, Asaliga, please, you can unmute.
Okay. Madam, I'm a little bit confused. For example, we gave 100 milligrams first, and then the first half-life, after that, we added 100 milligrams, making it 150. My concern now is, at that point, won't it be an overdose in the system?
No, it's not an overdose.
Okay.
It is not an overdose. It is not an overdose because you have eliminated part of it. When we say an overdose, okay, it is when you have gone beyond the the maximum therapeutic range. So the therapeutic range of paracetamol, what you can take within a day is a maximum of 4 grams. That is when you are even doing every 6 hours. Please, I hope you get me.
Yes,
So
madam.
if I should take about 6 grams of paracetamol, I have taken more than the daily allowable dose of the paracetamol. But this one, it is not, you are still within the therapeutic range for the drug. You have eliminated part of the drug and you are adding some. So this is not an overdose. Daniel, you can unmute.
Okay. Thank you, madam. Please, I'm a bit confused on the calculation.
Which
How
part?
did from the 87.5? And I understand that after the half-life, 100 milligrams is given. After the half-life, half of it will be excreted, which will be left with 50 milligrams. Then we top up with another 100 milligrams. So the 100 milligrams adding to the 50 milligrams that has already remained in the body, making up 150 milligrams.
Yes.
Then maybe in the calculation, what I did, and I had the 75 milligrams, the 150 milligrams, I added the 100 milligrams that has been added to the initial 100 milligrams. Then I made it 150 milligrams over 200 milligrams. Then I multiplied it by 100. So I had 75 milligrams. But when I came down, I don't know how
you won't get it again, because you are adding, by this time around, you've added 200 milligrams. By the time you get to the 87.5, you've added 200 milligrams. Please, I hope you can see that.
Yes, please, madam.
And you have eliminated half of it. So the way you did the calculation, you won't arrive at the same answer. All you have to do is half the number. So divided by 2.
Okay.
Daniel, are you following? So you added 100 to the 50. You got 150. If you want to know after the half-life, you want to know the quantity that will be eliminated or what will be left, divided by 2.
Okay.
Yes.
Okay. Yeah. Thank you very much, madam.
You are most welcome.
Very grateful.
Any other question? Are we okay with this? Are we okay? All right. Samed, please, you can unmute.
My problem is the percentages.
Okay.
I understand everything, but the percentage is my problem. How we calculate the percentages?
All right. Let me quickly take you through that. Okay. So, if I want to know the percentage of the drug that has either been eliminated or that has been that is left, I will have to compare it against what was given. So, in a calculation, okay, let me get a blank sheet. Just a moment. I want to get a blank slide. Okay. So if I want to know if I have 100 milligram of the drug, this is definitely the same as 100%. Sorry. Okay. So if I want to know after the second half-life, so after the first half-life, I hope that one, you know that 50 would have been eliminated and then 50 will be remaining. Okay. So that is also 50 milligram being the same as 50%. Please, I hope you are following. Now, at this point, I have to get my 50%. If I want to calculate the percentage, is 50 milligram divided by 100 milligram. And whenever you are finding the percentage of anything, you multiply by 100. Okay, so the milligrams will cancel each other out so that you have only the percentage that is remaining. The 100 will cancel each other out, and that's how come you have 50%. So this one is quite easy. But if we get to, let's say, the second half-life, where you eliminate half of this, to know how much of it you have eliminated so far, what you can do is subtract what you have left. So by the third half-life, let me delete this. By the third half-life, you would have 25 milligram of the drug remaining. So if you want to do the calculation, okay, you can subtract to know how much has been eliminated. You can subtract 25 from the 100 milligram. So the 100 milligram minus the 25 milligram, that will give you 75 milligram. And that shows you that you have eliminated 75 milligram. You have 25 milligram left. If I want to know the percentage of this, is the same way, 75 over, assuming the milligram has already canceled themselves out, 75 over 100 times, again, the 100%. The milligrams will cancel each other out, and I have 75%. Okay, please, I hope you are following. So I want to know what is left. I've already calculated what has been eliminated. So I can subtract the 75 from the 100, and that gives me what? 25%. Please, I hope, Samej, this is okay. You can unmute. Samej.
Yes, madam.
I hope you are okay.
Yes. Thank you very
Any
much.
other follow-up? All right. Daniel, please, you can unmute.
Okay, madam, please, with this one, assuming we are going to use the first one, that's not the first one, I mean the second example that the one I just ended,
Yes.
and then brought this one.
Mm-hmm.
So if we are adding up to the drug,
Mm-hmm.
and we are like working out for the percentage that has been created.
It's the same way.
Okay.
It's the same way. So at the first half, like where you had 150 milligrams, okay, you had the 50 milligram left and you added the 100 and you got 150. Please, I hope you remember that part.
Yes, please, madam.
Good. So if I want to know then, and at that point I eliminate half where I eliminated 75 milligrams. So if I want to know the percentage that I have eliminated, all right, now my total dose is not the 100. My dose there it was 150 milligrams. I have eliminated half of it. Please, I hope you are following.
Yes, madam.
Yes. So if I want to know the percentage that is left, I can two ways. I know that I have eliminated 75 milligram of the drug. and the total dose at that point was 150 milligrams. If I want to find the percentage, this is the same thing I do. So the 75 that I eliminated divided by the total amount of the drug times the 100%. And that will give you the percentage at which you have eliminated the drug, which is what? Hello?
Yes, madam, I'm still confused around at that point. The
Why
75,
are you confused?
madam.
Okay.
The 75. Like let's use this one, the 100 milligrams that is written here.
Yes.
Let's say after the half-life, we have 50% of the drug left. So that is 50 milligrams is equal to 50%.
Yes.
Then at that point we add another 100 milligrams. That's in the into the system. So the total will now 150 milligrams in the system. But I want to know.
I'm typing. So if
yes,
that is what you mean, you let me know.
Yes.
So
Yes,
we
please,
had 50.
Yes,
right?
please. Yes, please.
And then we are adding 100. And we
Yes,
have
please.
150 milligram of the drug.
Yes, please.
Good. So now I want to know, you want to know the percentage that has been eliminated or remaining.
Yeah, that is after the second life, the second half life.
So at the second half life, at this point, I am eliminating 50 milligram, 75 milligrams. Or
okay, madam. So why 75 milligrams?
75 because the half life at the end of the half life, you eliminate half of whatever is there. Please, let's not confuse ourselves with the percentages and the quantities of the drug. They are different things.
Okay.
This quantity of the drug is what you have eliminated. This quantity of the drug is what would also be left. So you had 150 milligram of the drug. At this point, from the 100%, from the 100 milligram, okay, at this particular point, you have 150 that you have eliminated. So you have eliminated 50% of that drug. But you have added 100 milligrams. So your total dose here now is the 150 milligrams. I get you. Are you trying to say that now it should be 150%? Hello, Daniel.
Yes,
I think
madam.
that is where probably your issue is.
Yes, I was thinking maybe we'll now use the maybe 100% that the 100 milligrams that we have added, we'll add it to the total first 100 milligrams, and we work it out, you know, the percentage that has been exploited or eliminated.
I still don't get what you are saying. Abel's hand is Jidofu. I've forgotten again, forgive me. Jidofu, his hand. Maybe you can clarify what Daniel is trying to say for me. You can unmute.
Yeah, hello, sister.
Yes.
Yeah, I think my brother was getting confused with the percentage aspect as you started with. So I was raising my hand to help in explaining it to him before. But I think...
Please, go ahead.
Yeah.
So with education is good.
Okay, if I understand you from the beginning, what you are saying is the 100 that you've written here are the 100 here is equals to the 100% that you were talking about. It's the same, the 100%. So when the first half-life has happened, there will be 50 milligram, which is same as the 50% that is left. So that 50% that is left, you have added another 100, which is the 100% of the medicine. Is giving you 150% or 150 milligram of the drug in the person. So that 150%, another half-life, the second half-life has happened on that 150, giving us 75% or 75 milligram. But I think he's confusing himself with the calculation of the percentage as you did from the beginning, but he is not getting it. So it's just that the 100, as the 100 cancel themselves and the unit cancels themselves, they will give you, let's say, what we have here right now, the 75, and we've added 100 to this 75, we'll be having 175. 100, yes, 175% or 175 milligram.
All right. Hello.
Hi, madam.
So for the third half-life to have 175 milligram of drug in the person, then you equally calculate it by adding, dividing it by the 100% to do away with the unit and get the percentage we are looking for.
Okay. Thank you very much, Jidofu. I want to try something so that's not to. I think the 100 is confusing some of us. So I want to do it this way and use 600 milligrams. Okay. So if I gave the patient 600 milligram of a drug, well, even let's assume that we are giving ceftriaxone. Okay. Sorry, ceftriaxone. 700, the normal dose is 700 milligrams. Okay. And that is what we are giving to our patients. At the end of the half-life, please just give me a moment. All right, please forgive me. I had to just answer a call. Okay, so we are giving ceftriaxone. Okay, so if I am giving ceftriaxone, and let's assume the half-life is, say, 2 hours. I think that's about the half-life between 1 and 2 hours. Okay, so after 1 hour, the concentration of ceftriaxone is going to reduce by half, 50%. Let's note that at every half-life, 50% of whatever is in the body is what is going to be eliminated, and 50% is what is going to remain. Let's get that clear. So at the end of the half-life, this will be reduced by half. Please, can someone reduce it for me? It is going to be 325 milligram. Okay, meaning that I have 50% of the drug left. Please, I hope you are following. I want us to look at it using just a single dose of the drug. Then, Daniel, a number without a unit means nothing. Please note that. If you write an answer like that in an exam, you are wrong. And you will definitely be marked wrong. Okay? All right. Now, after the second half-life, I am going to halve this because that is what is there. That is what is left. If I halve 325, what do I get? Please, halve 325 for me. That would be 16, is it 4.5? I hope I get I don't have a calculator with me. And it means that at this point is half of the percentage that was left that I am. Is it 162 or 165? Okay, 164, 162. Okay. At this point, I am halving whatever is left. Please, let's note that. So at this point, at this 162, if I want to know the percentage of the drug that I have eliminated, the first one is wrong. Okay. 2 into 77 is what? 3, 15. Okay. So that will be 7. I think it's 7 rather. 75, please. I don't have a calculator and I can't open the calculator here too. So please check for me. Okay, so the next one will be 18.75. Good. Okay. So if I want to know what percentage I have eliminated so far, mind you, at this point, I have 25% of the drug left. I want us to look at it from this point before we look at it from when we add on the drugs. Okay. So if I have 25%, I want to know how much I have eliminated so far. At this point, all I have to do is 2 ways. Either subtract the 25 from the 100% here to get the 75%, or subtract the 187.5 milligram from the 75 milligram and find its percentage. So 750 minus 187.5. If I get that number, I divide it by the 750 and multiply by 100 again. And I get my percentage, which I'm sure will give us the 75 that we have eliminated. Please, I hope you are getting. Now, at this point, I had 375 of the drug left. 375 of the drug eliminated. If I should add 750 okay. Yes, that's the first example that I gave, Abigail, that you can add the 50 and then the 75 to the 25 to get your 75. You can equally subtract the 25 from the 100 to get your 75. There are many ways of killing the cat, so far as you arrive at the answer. Okay, you can do that. So at this point, I have added 75 milligrams of the drug. Okay, it means that I am increasing the percentage as well. It's no more 50%. So if I want to look at it in terms of percentages, then I have to add, because at this point, okay, I've added more of the drug. So the percentage is no more 50%. I think I'm now getting Daniel's point. It's no more 50%. I've added another dose. So I am now going to have what? 150 milligrams. Okay. If I halve this, so 375 plus 750, what do you get? What would I get, please? That'll give me 5, 2, 1, and I think 1. Okay. So now I have this amount. In terms of percentages, this is 150% of the drug because I've added more. Please, I hope you are getting me. If I am reducing by half, this is what I am reducing by half. So I divide this by half. If in terms of percentages, you have to divide this also by half. So if I divide this 1125 by 2, what's the answer? 562.5 milligrams. If I want to find the percentage of 562.5 milligrams, is half of 150. So I can either decide that, okay, 562.5 divided by 1125 times the 150, and that gives me 75. So at this point, this is the amount of drug that is in the system, 75% of the drug. Yes, please. So you realize that we are still talking about the same thing. We are still trying to reach the steady state concentration where the amount of the drug equals the amount of drug that you are administering, or the rate at which you are administering the drug will equal the rate of elimination of the drug. So if we should add again, the percentage would also increase. And by the time you get to the end, your amount of drug will be nearing the 750 that you have been adding. And then the rate at which you are also eliminating, they will all be near 100%. Please, I hope this is clear enough. Jidofo, your hand is up. Please, you can unmute.
Okay, sister, thank you very much. That means if I'm getting you clear right now, it doesn't matter the milligram of the medicine you are giving, but just know that the milligram equals to the 100% of the drug, and as it's okay. So as it goes, the half-life always deal with the half of the medicine that is currently in the person.
Yes.
Whether you add or you didn't add.
It's half.
Okay. Thank you very much.
It doesn't change. It's half life, a constant time. So if it is 2 hours, it's still 2 hours. And so the amount that is there, whatever amount that is there, that is the amount that will be halved. Please, I hope you get it.
Thank you very much.
You are most welcome. Happiness. You can unmute.
Ma, please, the time, the half-life, that's the time. Initially for paracetamol, you use 3 hours. And then you use the second one, you use 1 hour. So the time, does it come, the half-life rather, does it come with the question?
Every drug has its own half-life. Every drug. So for some drugs, it's even just a few minutes. So you would find it. That's why I was saying earlier in my presentation that if you want to know the half-life of a drug, if you don't know it, you can't find it in the drug information. Okay, you can easily calculate it. If you know the volume of distribution of the drug and the clearance of that drug, you can calculate it. But you can easily find it from the information about the drug. If you buy a drug, let me see if I can get how to stop sharing, then look for let me see something online. Pharmacokinetic profile. So I'm using paracetamol again. All right. And let me go to I was looking for, yes, drug bank. Then I'll share it for you so that you see what I am talking about. Okay. Yes. So I typed in pharmacokinetic profile of paracetamol. And you know that the generic name of paracetamol, even in some parts of the world, paracetamol is accepted, okay, as the generic name, but it is acetaminophen. So if I'm looking for information about acetaminophen and I type it like this, and I go to the pharmacology of it, okay, the pharmacology of it, it will give me a lot of information, okay, conditions that you can use it for, the pharmacodynamics or the responses, the effects of it is there. Mechanism of action of paracetamol is there. Absorption. So under absorption, we are looking at the oral bioavailability. Okay, so it's telling me that oral bioavailability is 88%. And it reaches its highest plasma concentration after 1.5 hours after you've taken the drug. It means that if you are even thinking or seeing the therapeutic effects of paracetamol when you take it orally, you need to be expecting it after 1.5 hours. Okay, good. I want to quickly move on to the half-life. So another, if we talked about volume of distribution, it's saying that the volume of distribution is 0.9 liters per kilogram. Okay, that is what it's telling you. It is also telling you that it is 10 to 20% bound to red blood cells. This is all pharmacokinetic properties, and you should know what that means. So let's move on to the half-life. Okay, they are saying that if you give an intravenous dose of 15 milligram per kilogram, so for 1 kilogram, if you give paracetamol 15 milligrams, the half-life for the adult is 2.5 hours. I gave you a range of 2 to 3 hours. Okay, so this for here, you have the half-life information given to you. Even with the same information, you have the clearance here is 0.27 liters per hour per kilogram. Okay, that of the child is also here. You already have the volume of distribution given to you. So even if the half-life is not stated here, you can calculate it from the formula 0.693 times the volume of distribution divided by the clearance. So that is how you can get the half-life. But note that every drug has its own volume of, has its own volume of distribution, have its own clearance rate, has its own half-life, bioavailability. Every drug has their own. Okay, all right. Salome, please, you can unmute.
Hello, doctor.
Hello.
Please, for my question is, with everything that you are saying, it means that if a drug is being administered, plus the number of days that a person has to take the drug, if the person is to follow it regularly, at the end of the last dose of the drug, the bioavailability still has to be equal to 100. That is, before it will start deducting it within the half-life, so the drug finish in the system.
Okay, let me show you something else. I get your question, and please, bioavailability is not the same as the half-life. Please, let's not use them together like that, okay? So let me show you a graph, okay? Let me show you a graph, and hopefully I'll be able to use that to explain. So you started, please, I hope you can see the graph I'm showing you. So if I gave a drug at time 0, okay, at time 0, after the first half-life, 50% of the drug is eliminated. I may have added, or I don't even add, but at the end of the day, by the time you reach between the 4th and 5th half-life, you would have reached the steady state concentration. So let's assume that the patient started taking the drug from day 1. They continue taking their medicine over the couple of days. The drug will still continue to work, because as you continue adding more drug, the concentration also increases. So the drug will continue to work, and it will continue to work till the point where you don't take the drug again. If you don't take the drug again, then the drop will start from wherever you left it off. So at this point, let's say the concentration of the drug is, say, the 562.5 milligrams. That is where you have stopped taking your medicine. After the next half-life, half of the 562 is what is going to be eliminated. At the next half-life, half of whatever is left will be eliminated until the drug completely leaves the body. And that is how come, even after we have stopped taking our medications, after a couple of days, you still see the effects of the medicine, because the drug has not completely left your body. And there are some drugs that can even stay in you in active concentrations for a couple of weeks, and it will still be working. All right. A drug like this anti-malarial preparation, Diatec, Artemether, and is it Papiraquine? Yes. It gives you protection up to 6 weeks after you stop taking it. You took it for just three days, but the drug can stay active and protect you from getting malaria again for the next 6 weeks. Please, I hope I've answered your question. Was it Salome? Yes, Rose. There's something that I need to talk about, so I'll give the last question to Rose. Yes.
Yes, okay, madam. Madam, please, I want to ask if the steady state concentration of a drug is the same as the peak of a drug. Because back then on the field, we've been saying the drug has reached its peak, it has not reached its peak. So I want to ask whether it's the same thing. It means the same thing.
Okay. The peak is the highest concentration that the drug, when you introduce it into the body, it reaches. So you can actually measure to see whether the drug is in its peak. The steady state concentration, it's a constant concentration. So far as you are adding and taking, okay, the drug will still will remain in that concentration, but the peak is the highest. So I give a dose of a drug. It reaches its peak, but the drug will start declining. When I add again, it will reach its peak. It will start declining because the body will start metabolizing and eliminating it. Then it will, so that's the reaching of the peaks. So you can have multiple peaks being multiple. I don't know if I've answered your question. Okay. Daniel, I know you have a question, but kindly hold on to your question, because if I have to talk about this part, okay, the loading dose and the maintenance dose and what it means to us as nurses. Okay, we know that the loading dose is a higher than normal dose of the drug. Okay, a higher than the normal dose of a drug that is given to achieve the critical concentration or the therapeutic concentration as fast as possible. In the management of certain infections, you know, in our part of the world, when people come to the hospital, by the time they come, they are in very bad situations. And so when you want to reach the critical concentration or the therapeutic concentration, where you start seeing the effect of the drug as quickly as possible to improve on the patient's outcome, then you would want to start with a loading dose. Okay. The loading dose will help you reach the therapeutic concentration very fast. Typical example, cefuroxime. If I want to manage a case with cefuroxime and it's a very bad case, and I want to give the loading dose, usually prescribers will start with 1.5 grams. So that is a loading dose, a higher than normal dose that is used to reach the therapeutic concentration as quickly as possible. To reach the or maintain or establish the steady state concentration, you continue with the maintenance dose. And that is why I was saying that it is important that you take your medications the way or the times that you have been asked or educated to do so. As nurses, we need to educate our patients and educate them well. It is their right to get the right education. It is their right, okay, to get the right education. You can't just tell the person that when you go, this medicine, you don't even tell the patient the name of the medicine. This medicine, when you go, take 2 tablets every in the morning, in the afternoon, in the evening. If you don't give the person the times they are supposed to take it, they will take it at different times, which will not augur well for your patient. The patient may have an overdose if the amount that should be eliminated has not been eliminated, and they go and add. Okay, they are likely to get an overdose or a higher than normal dose, which would result in certain side effects that typically, or adverse effects that typically the patient will not have when they took, if they are taking the normal dose and taking it at the right time. Please, I hope you are following. Okay, so it's important that we educate ourselves, we educate our patients to take their medicines at the right time. So if it is supposed to be at every 6 hours, let's tell them, let's give them examples. So if you take your medicine at 7 a.m., the next 6 hours will be at 1 p.m. The next 6 hours after that would be at 7 p.m. The next 6 hours after that would be at 11 p.m. That leads me to answer one of the questions that was put in the chat. The Let me see if I can find the name, but I remember the question. And the person was asking about, where is it? Okay, so this is what Frank is asking. Why is it that administration of medicine mostly does not go throughout the night to the next day, but is either BD, TDS, QID, or OD? If and the question is, don't have life take place throughout the night? It does. It does. If the person comes to the hospital at night and say you start your medicines at 11 p.m., the next 12 hours, if the person is taking it at what do you call it? The next dose, it will be 11 a.m. The next dose will be 11 p.m. So it's all about the convenience of taking the medicines. Okay. So you want to give the medicines whilst the patient is awake, and depending on the frequency of the dosing. So it's every 8 hours. You start the medicine at, say, 6 p.m. The next dose is going to be at 2 a.m. and it's still in the night. So it's all a matter of arranging the time. That's why I was saying that earlier. You give examples. You also listen to the patient's lifestyle. If the patient is someone who sleeps very early, wakes up very early to go to the market, you can't say that the person should wait. When they wake up, okay, when they wake up, they shouldn't take their medicine. They should wait until daybreak before they take their medicine. When that happens, the patient is not going to comply to their medications. So you need to sit with your patients, calculate the times. And the reason why we don't usually want medicines to go through administration to go in the night is also that you don't want to disturb the patient's sleep. So if I can give the medicine at 6 a.m., 2 p.m., and then 10 p.m., okay, from 10 p.m. to the next time is the 8 hours, is 8 a.m., and we are within the range. All right. If you are doing every 6 hours, and it is one of the mistakes that a lot of us do when it comes to the administration of QID medications. If they just write QID, it means that give the drug 4 times within the day whilst the patient is awake. That is what it means, QID. Give the medicine 4 times a day whilst the patient is awake. But if they write Q6H, it means that you are supposed to give the drug every 6 hours. Every 6 hours. So if you started at 6 a.m., you have to give the next dose at 12 noon. You give the next dose at 6 p.m. Give the next dose at 12 a.m. When the patient is still asleep, you need to wake the person to give the medicine. Okay? Please, I hope I'm making myself clear here. It is for the convenience of our patients that we start administration early. And it is also wrong on our part as nurses to say that, oh, the time the patient came, if I start the drug administration now, it will eat into the night. So I'll let the patient remain there. If the patient remains there and they die, you'll be held responsible. You cannot say that the drug administration charts, they have put times there. So I am sticking to those rigid times. No. When the patient comes, as you are aware, most of the patients who come and are admitted into our wards, they are patients who are very sick. Ordinary Ghanaian, you and I, me, if I can manage myself, I will not report to the hospital. I'll only report when my situation is very bad. So you cannot say that I have come at 11 p.m. And you know that if you gave me a drug that is every 6 hours. It is going to eat into the night. So you will not give me, or the drug is supposed to be given every 2 hours. You will not give me the drug, you wait. When it is 6 a.m., then you start. You might kill me. Okay, so please, when the patient reports to the hospital, let's start counting from there. You do not go to work to go and sleep. Night nurses, we did not go to go and sleep. Morning nurses and afternoon nurses will say, oh, if we start the drug administration at 4 p.m., it means that the patient, the night nurses, they are going to, they will not sleep. Please, we didn't go to work to sleep. If it is about sleep, you can sleep in your home. You can sleep in your home. Start the patient's medications. Yes, there are some conditions that you can wait a little bit to make it synchronized with the normal ward activities, the routine activities. Yes, but majority of the time, the patients we have, if we don't take care, we end up killing them. We hasten their death. All because we don't want the night nurse who is coming to say that, oh, you this nurse, you yeah, you don't want us to sleep when we come for night. Please, let's not do that. All right, Diana, please, you can unmute. Our time is up, please. I've been one that I've been taking people's time. Yes, Diana.
My question is, sometimes a patient will come at night, and then especially the oral medication, let's say nifedipine, for example, and then you give the medicine at night, but the medicine is supposed to be taken daily. And then the next day, in the morning, you serve the medication again. Is it right? Or you have to wait till the next 24 hours before you serve the next day?
Yes, please. You have to wait 24 hours, then you start serving the medication. What you can do, if let's say the patient, after talking to the patient, you realize that, oh, when the patient goes home, they can't continue taking the medicine at that said hour. When the patient is on the ward, okay, you can start reducing the time. I already said that you can give the drug 1 hour before, 1 hour after. It is still okay. So let's say the patient came at 11 p.m. and you gave the medicine at 11 p.m. You talk to the patient and the patient said, oh, this morning I've not taken any of my medicines. So you give it at 11 p.m. If the patient is on the ward, you can find out, talk to the patient. Okay, when you go home, can you continue taking your medicine at 11 p.m.? If the patient says yes, then you continue. So it's daily. Every 11 p.m., they take it. To maintain the concentration of the drug. If the patient says no, if it's say at 8 p.m., I can start taking it, then you can give it the next dose. Instead of 11, you can give at 10. Okay. The next 24 hours, you can bring it forward again at 9 p.m. The next one, you can bring it forward again at 8 p.m. Then subsequently, the patient can be taking it at 8 p.m. every day. So it is 24 hours. Please, if the medicine is supposed to be taken 24 hours, let's not look at the convenience of us nurses. The patient is not there at your convenience. The patient is there. And if you've realized you gave at night, you repeat in the morning. If you check the blood pressure and you are actually checking it well, you see a profound drop in the blood pressure, which you also don't want. Last question to Daniel, and then I will finish up and we'll close. Hello, Daniel.
Okay, madam, thank you. Please, mine is on the still on the calculation. This one I'm okay, but with the calculation, I'm okay with the concentration of the drug or the amount of the drug that is remained in the body when we are adding up. but the amount and the percentage of it excreting or eliminating a particular time when we are adding, that is the point that I'm not okay.
Okay, Daniel.
Madam.
What we can do is time. We can schedule a call, all right, and then
okay.
I would explain it to you.
Okay.
Okay.
But madam, please.
Yes.
Your number, your number, please.
Oh, my number, you sent me a message. I responded and came to reply. So click on it. My number is there.
Okay. On the chat box.
On the Telegram page.
Okay.
You asked the question. I responded.
Yes, please.
And you came
yes, please,
to
madam.
respond. Yes. Click on it.
Yes,
you see the number. And you can send me a message. Okay.
Thank you, madam.
I have seen your number, so I'll call and explain it much further.
Okay, madam. Thank you, madam.
All right, please. This synchronization of the usual time, I want us to avoid it because the side effects that some of our patients are experiencing is because we want to synchronize with the word, with the routine of the word. No, every patient is unique. The times they came to the hospital is not the same, and they will not leave the hospital at the same times. Okay, so if the patient came at say 4 p.m., please start the patient's medications and change the routine time. So if you give that one patient their medication, let's say at 8 p.m. or at 2 a.m., what will happen to you? Like I said, we do not go to work to go and sleep. That is not what we want to do. We want to take care of patients. Let's do that. Okay, let's do that. Okay. Yes, please, you can. You can. Okay, you can. You can. Yes, Ebenezer. It is very, very wrong. Please, you see, it is not all antihypertensives that have to be taken in the morning. So if the patient came at night and their blood pressure is very high, would you wait till the next morning? Would you wait for the next morning and say that 6 a.m., that is when you are going to give the patient their medication? No. You will end up giving the patient a stroke, or the patient may even die. So let the patients, when they come, start their medications. Like I was showing you, you can easily bring the time back to the routine. You can easily do that. But when they come, please give it to the patients when they come. You served it at 2 a.m., please. What comment did your in charge give you? I would have loved to hear, but it is time. Okay. Hopefully, and we can continue this conversation next week. All right. Thank you very much. And enjoy the rest of the lectures for this weekend. We will talk about the midterm, but I would like us to do a quick quiz. Okay, a quick quiz. Hey, okay. We'll continue the conversation on the Telegram page. Your in charge said you don't know what to do. Anyway, in charge and so yeah, not that. Anyway, enjoy the rest of the weekend. God bless you for coming. Bye.